Executive Medical Director of Infectious Disease and Prevention and Advocate, Aurora Health, Dr. Robert Citrenberg. Good morning, doctor.
Good morning.
So the cynic would say, is this more of a health decision or an economic decision when we have so many different workforces decimated by COVID cases?
Well, Lauren, I think it's a combination. First, the science, the understanding of the science has changed. We now know that most people are no longer contagious after about 3 days or so of symptoms. Occasionally, people can be contagious for longer than that, but keeping people out of the workforce has very significant ramifications, especially in healthcare where I work, where we have critical staffing shortages in our hospitals and hospitals around the country. So it's equally important to have people there. If somebody comes in with a heart attack or a stroke, you want to have people there to be able to take care of them. But it is based on changing understanding of the science that 10 days is probably a little bit too long for most people to be isolated.
And still, 10 days to 5 days seems like a pretty aggressive cut. If I tested positive tomorrow, I don't know that I'd feel comfortable, coming back to work without having at least a negative test.
As long as your symptoms have resolved, the likelihood that you're still contagious is low. And I think there's some confusion about the concept of repeat testing. Remember, the tests, whether it's the PCR test or the antigen test, they're not detecting live virus. They're detecting genetic fragments or pieces of the virus. And those tests can stay positive for many days or sometimes weeks after you're no longer contagious. So we don't usually look at a test of cure, in other words, a repeat test in order to clear you, because your test can stay positive. So really, once those symptoms have resolved after about 3 days, most people are no longer contagious. There are occasional people, if you're immunocompromised, you might be contagious for a little bit longer. But I think that's why the other part of the recommendation is to wear a mask for those additional 5 days.
If you are concerned that maybe possibly someone in your workplace has exposed you to COVID, would you, if you could get your hands on a PCR test, not a PCR test, on a rapid test or try to get a PCR test, which one would you recommend at this point?
Well, the PCR test is certainly more accurate, but they're much more difficult to get, and the turnaround time is obviously going to be longer. The antigen tests, the ones that you can buy over the counter at the Walgreens or the CVS, those are very accurate for people who have symptoms. They're a little bit less accurate if you don't have symptoms for routine screening. But once you have symptoms, they're extremely accurate, probably about 95% accurate, and they can be done in about 15 minutes. So I think the antigen test, the over-the-counter test, is the better option for most people if they have symptoms. Remember, the PCR, the problem is that it just takes longer to get the results back.
Were you surprised by this decision to go from 10 days to 5 days? Was it expected?
I think that it was a little sudden. I know this had been in the works and discussed, but there's been a lot of pressure from industry and other people to get this moving. So, yeah, I think I was surprised by how fast it happened. I don't disagree with it. I think it's the right move. It is a big change for many people. Some said, well, maybe you should have just lowered it to 7 and then to 5. But I think the science, for the most part, supports the 5-day period. So it's just going to be getting used to for many people.
All right, Dr. Citrenberg, thank you for joining us. We really appreciate your time this morning.
Thank you.
Thank you.
Time now is